Before COVID hit, I was working on the aged care wards, doing slow stream rehabilitation for older patients. Since COVID-19, I've still been working with older and aged care patients, but on the COVID positive wards.
Before COVID-19, I was working in the respiratory, cardiothoracics and general medicine units, and currently I'm working on the COVID positive wards.
So speech pathologists have a role helping patients who have difficulty swallowing either their saliva or food and drink. Much of the same muscles we use for swallowing are also used in communication, so we also help patients who have difficulty communicating.
We have been seeing patients who have been in the intensive care unit, who have required tubes going down through their mouth, their throat and into their airway in order to receive mechanical ventilation. And we have also been working with people who have tracheostomy tubes who've needed longer periods of ventilation. And the reason we've needed to be involved is because the combination of the patient's medical condition and these tubes can actually cause weakness of the muscles that are involved in swallowing. It can contribute to changes in airway anatomy. It can impact our patient's ability to cough. And this can be quite serious because it can contribute to food and drink going the wrong way into the airway, which can have some really serious complications. An N95 mask, a face shield, gown and gloves. And for those of us working on the COVID positive wards, we're also needing to wear hair coverings, an additional plastic apron over our gown and shoe coverings. And this can obviously get quite hot and uncomfortable. But the other thing I found is that it's been quite hard to actually connect with our patients because they're only able to see our eyes. So we're not able to give them a reassuring or a comforting smile anymore. Patients who have communication impairments are no longer able to rely on our facial expressions or lip reading in order to help with their understanding.
Who have had COVID, battled with COVID and then come out the other side. And we've actually been able to get these patients home or back to their aged care facilities.